I'll read the speech. I wish to thank Mr. President Dr. Goodluck Ebele Jonathan, GCFR, for his invitation to us in the National Assembly to be part of this all-important summit on universal health coverage in Nigeria. The World Health Assembly since year 2005 has by its resolution made universal health coverage a global agenda priority for all member states. There is no doubt that when the cost burden of healthcare is shared widely and evenly, patients and families have increased coverage, resources are better utilized, and health outcomes are improved. The health of every Nigerian is important and need be guaranteed. As we seek to achieve a more efficient health financing that puts risk and shares healthcare costs equitably across the population, we must make the right policy choices that will be implementable in our nation, considering the economic status of our families, our national economy, administrative structure of our government, and the state of the healthcare infrastructure and resource countrywide. Mr. President, as we count down to year 2015, marking the end of the Millennium Development Goals, there is no doubt that we have defined an era of global health. The global response to HIV/AIDS and childhood immunization has been scaled up remarkably, and our country, particularly in your tenure as President, has, in line with your transformation agenda, scaled up resource allocation and provided the needed political will in maternal and child health care issues. We congratulate you. While the world appears to be making progress in universal health coverage, a lot of our people are poor and continue to be denied access to good health care service, their only option being to pay for health services out of pocket. We in the National Assembly are pleased that you have in your caring and transformational program called this summit to discuss how best we can give health care to our people. There is no doubt that a healthier population will be a happier people, more productive and committed to their fatherland. Mr. President, as we make our policy choices and define our model of healthcare financing best for our country at this summit, there is a need for an institutional structure that is adequate, efficient, and accountable, a strengthened health service, infrastructure, and resource made available, accessible, and functional, an effective integration of primary health care with the universal health care program, equitable and quality service delivery, improving customer satisfaction, and the distribution and efficiency of human resource for health. Universal health coverage, no doubt, is a vehicle for sustainable growth and development. All relevant stakeholders must therefore be brought on board. There is need for education and advocacy programs to enable citizens buy-in. Mr. President, as we navigate the legal, financial, and political framework to achieve universal health coverage, we rest assured of our cooperation in the National Assembly. As a National Assembly, we will help to consolidate and strengthen the legislative framework needed to achieve the resolutions of the summit, and will be willing partners in our drive to achieve better population coverage. As part of our contribution, the National Health Bill was recently passed in the Senate. Beyond providing a framework for the regulation, management, and development of the health system, it makes a bold attempt in providing for health coverage, at least for the vulnerable persons in our society. As we join our voices in advocacy for universal health coverage, a platform for achieving healthier living, poverty eradication, and more sustainable development, the role of civil society organizations must be recognized. Mr. President, I congratulate you on yet another milestone achievement. We are with you all the way in this program being put forth to achieve a healthier population. May God grant us deliverable outcomes at this summit. Thank you, and God bless you all.